Welcome to the Trusted Podcast with your host, Blake Johnson. In each episode, Blake interviews professionals in different areas of life that you need a trusted source of information, including trust and estate planning. You can find this show on all the major platforms, including YouTube, LinkedIn, Facebook, Apple Podcasts, Spotify, and on our website, trustedepa.com. Now, here's the host of Trusted Podcast, Blake Johnson.
Hello, everybody, and welcome to the Trusted Podcast. It's so great to be with you today. Really excited to talk about charitable giving today. And so with that, we've got Cindy with Intermountain Health Philanthropy. And Cindy, welcome to the show.
Thank you so much for having me, Blake. It's an honor to be here.
Yeah, so Cindy and I work together because I'm on the Utah Valley Philanthropy Board for Intermountain Health. And so I thought it'd be a great idea to get her on here and talk about, what she does specifically. And then also, so anyone out there working with different institutions can know what kind of resources you have out there for different for working with planned giving or, things like that. So Cindy, give us a little bit of background about your journey, how you got here, and, what makes you qualified, essentially.
Oh, thank you so much. I feel like my journey is quite the story. I'll begin when we lived in California, in Northern California. I married my high school sweetheart, and we started our family, and our first baby was very premature, and she was very ill, and I became very aware of the need to know medical terminology and get involved. And then that was over and done. And then I had my second pregnancy. I found myself with twins, and I delivered even earlier than you'd ever want to deliver babies, and at Oakland Kaiser. And so my firstborn only lived for a day. My secondborn is now 40 years old and a scientist and works in Salt Lake City and has 5 children. My last baby was also premature at Kaiser in San Francisco. So I became an expert at having these babies, but I didn't want to do that anymore. So I think my biggest learning experiences in life were having to get to know the medical personnel. And then I wanted to be in that profession. And so because of all those experiences, I had learned a great deal. So I found a parent support group out of UCSF, and they were really helpful. And then the opportunity arose for me to be able to work for them. So I became a parent support specialist and worked at the North Bay chapter in California, and worked with many different hospitals, many parents, and did what we called it matching. We matched parents with other families who had similar experiences. And this is before it's very well done now, but this is in the very beginning stages of doing something like that. So that's where my passion for being involved in healthcare began, and being involved in philanthropy.
Awesome. Well, what do you like to do outside of work? Something interesting or unexpected that people might not know about you.
Well, being born and raised in Napa Valley is kind of fun. I don't live there anymore. I wish I still did sometimes, but I love Utah. But Napa is still quite a bit of home to me. I have family there still. So I like to go back and visit there. And then South Lake Tahoe is my other favorite place. We love to travel. I love to swim and walk and do fun things. I have 13 grandchildren now, so I feel like I'm pretty well established.
There you go. Yeah. So it's funny. I lived my first couple of years of my life in Napa. My dad was working out in that Bay Area. So
yes, we're going to have to touch base on that one.
Yeah. All right. So you've already kind of covered why you do what you do. Why don't you give us an overview of what a philanthropy officer does, and maybe go over the basics of giving to, major organizations or major charities. 'Cause I think people are almost intimidated by some of that. They think, oh, I got to have big dollars to do these kind of gifts and that kind of thing.
That's a great question. Thank you. So after moving back to Utah, I finished my degree in community health at BYU. And that was after my family was raised and we were all in college at the same time. And that's where I began my real work in the philanthropy world. I found myself working at really fun organizations like March of Dimes. And so I worked there for quite a long time. And I got to know people in many different walks of life. And I would say that getting involved in community organizations is a really good way to get in your foot in the door into philanthropy. So there's 4 ways of giving to organizations, and this could be a small organization or a large organization. But annual giving is our first area of giving, and people do ongoing gifts. It could be a monthly gift or just a yearly gift. And sometimes it's as small as $20. Sometimes it's $100 or $1,000. That would be considered an annual giving gift. The second area would be major giving, and it's more of a strategic plan. Donor may have a grateful patient attitude. Maybe that donor had a grandchild that went to Primary Children's Hospital and was treated at that hospital. Or maybe they even had an episode with cancer or heart in their family. So we find that major giving, usually it's around $25,000 and above in the $1 million range and even $10 million range. So then the next way of giving would be planned giving. And we mentioned that. And that's when you really take into account your assets and you think about what you want to do, that you can make a legacy gift. Because making a gift to a hospital or to a program within a hospital is something that your family will never forget that you did. And also you'll make a difference. There's oftentimes naming opportunities. And I've had donors, I'll tell you a story here, a donor that had lost his wife recently and he wanted to make a difference. So he did a very large $100,000 gift. That's considered a major gift. And he has a really nice naming opportunity in the foyer of that NICU. And so I would say that it's not to brag about what you've done. It's more to inspire other people to do the same thing. And I would agree that naming opportunities are sensitive and we want to make sure it's right. Some people will name naming opportunities in the $3 to $5 million range, and they'll name it after a child or after a foundation that they have in their family. And then the last area of giving would be a blended gift, where you do a planned giving and a cash gift. And oftentimes people like to do that. They'll do a cash gift now, and then they'll put us, I say us, meaning Intermountain Foundation or whatever charity, into a bequest where they might get a percentage of their estate after they pass, and they can do it as a legacy gift. And even my husband and I decided to do something like that. We felt that was really a powerful way to make a statement that we believe in what they're doing is right. So those are basically the 4 areas. Are there any other questions about specifics of those areas?
No, I just want to make a couple of comments, especially about the planned giving, since that relates so much to estate planning. Even if you aren't charitably inclined, there's a lot of major tax benefits that can come from doing those, planned giving opportunities where you're not necessarily going to reduce your estate value for what your kids would get. There's some really creative things we can do, but it all centers around having a charity involved that you would like to use. And so, a lot of fun things we can do there. That's some of my favorite things to do is to come up with those plans there. It's helping great organizations as well as helping the client with their tax implications. It can be an income tax deduction now, plus, reducing their estate tax and all of those things. So, that's really where fun stuff happens. But I love that you point out it can be as little as $20.
That's right.
Every little bit helps, every little bit counts. And we've talked about this. I've heard about this, but the major, I think, myth that we hear in the plan giving area is, well, they already have a bunch of money. Why do they need more? Like, especially a hospital, they're charging for their medical services and all that. Why did they need charitable donations? So maybe you could speak to that.
That's a really great question. Right now, we wouldn't be able to have all of the extras that we have in our children's hospitals if it wasn't for philanthropy. I'll give you several examples. First of all, in the new Miller Primary Children's Hospital in Lehi, Utah, we have several areas. We have Sophie's Place that's philanthropy funded. We have the Kids Zone where books and teachers are provided for the children in the hospital. That's all funded through philanthropy. We can provide the essentials. We can do a really good job of doing it right. But to do the extras, we have a Ronald McDonald House in this hospital as well as in the Salt Lake campus. We have other outpatient services. We have telehealth services. Those telehealth crisis services are available for all rural communities, stretching all the way through Utah, Idaho, Nevada. And we're able to fund those through philanthropy. And we have an expert doctor at Primary Children's Hospital in Salt Lake that might be connected to a rural hospital and be able to determine whether or not that child should be transported by ambulance or through life flight, and how fast do they need to get there? And then what essential needs does that child have right at that very moment? So that is also funded through philanthropy. There's other programs like the Fetal Center at Primary Children's Hospital. It is now open and running, and we're serving over 500 women and families a year. And it's the only center in the West that does fetal surgeries in utero. And so that was all philanthropy funded. And so these are the extras. These are the specialty programs that hospitals really can't afford to do. So it's building the community and being able to establish all of those extra that other hospitals just don't have.
Yeah, and we say extras. It's not like you're charging extra for this thing. These are extras that are not billable, so the hospital can't make any money on it, and so there is no way to provide for that.
Correct.
Without the philanthropy services. I got to tour Primary Children's recently and saw that virtual telehealth, and it was astounding what they could diagnose and do in a simulation over that. And they were saying that they say they're keeping 60% of those calls from life flighting up. In the old days, they would have life flighted them in, bankrupted a family because of the cost of that, and they didn't really need it. And so that's stuff that's really cool. It's actually saving the hospital money because most likely that bill's not going to get paid, and it's saving that family from going through a really tragic event on top of having the medical emergency.
Yeah, you're exactly right. I thought of one other area that we might touch on is that we do provide a lot of charity care, and a lot of times people will give their gifts specific to area of greatest need. And we don't turn away any children at all at Primary Children's Hospitals. And so we do have a lot of donations that come straight for charity care that means the world to families. I know of a particular family who had a child with a heart condition at Primary Children's Hospital. And this particular family went to pick up the prescriptions to take the child home after open heart surgery. And she said the prescriptions were higher than her house payment. She burst into tears and she just said, I can't do this. I don't know. My child is just going to stay in the hospital. I can't take him home. I can't afford it. So the pharmacist was really sweet and sent them to the right person to talk about charity care. And in this particular situation, it was just the perfect example of how that really blessed their lives.
Yeah, there's so many good stories out there, where these things can make a difference. Are there any other major myths that you see in the giving space where people just have misconceptions about why, they should give or whatever it may be?
I think that the one that you mentioned is the most prevalent, but I also would say that People have a lot of fear and they want to make sure their money goes to the right place. When I worked at some local charities prior to Intermountain Health, I knew that only 75% of their dollar that they spent went to the program. The rest was overhead. At Intermountain Health and Foundation, 100% of any donation goes exactly to the area that donor wants it to go. And donors have the right to have what we call donor intent. And if they have a passion for a particular area, they can have their dollars go to that 98% of the time, I would say. I can tell you another specific example is a donor wanted to support just cancer services. And we have really expanded our cancer services in pediatrics. And so they wanted to make sure their dollars went exactly there. And we have funds that are set up so that that donor can have that donation go exactly where they would like.
Yeah, my wife and I have been able to do that too. So we had a baby in the NICU as well. And so that's a particular area for us. And so we made sure to earmark our donation for that kind of stuff. And yeah, it's really cool you can do that. What resources do people have to see for, let's say it's not Intermountain Health, but they want to check on another charity to see how much of their stuff is going to overhead? What kind of questions should they ask? Who should they be talking to? That kind of stuff.
Well, I think they should talk to the manager or director or CEO of that area, of that charity, and discuss it, because a lot of local charities charge a lot, and it's getting worse in time because the economy is difficult. So it's not as easy to pay your employees. And so you may want to double check on that. I can just assure people for Intermountain Health, I can't speak to other charities. I just know I've worked for several. And it's very rewarding to work in the community for other charities. I loved it, learned a lot. But my most rewarding experience has been with Intermountain Health. And I can say that because I've been here almost 8 years, and it's a good place to be.
Awesome. What types of things should people consider or do before they come to someone like you with a gift?
Well, I think the most important thing is to think about the why. Why are you going to do this? And if this is meaningful to you and you want to make a difference, then absolutely reach out to me or anyone else in my role, because we'll be able to help you. We're very flexible. And so let's just talk about how you can give gifts. You can do something online. You could do it through our website. You could do a credit card. You can send in a check. You can talk with someone like me, and we could set up what we would call a pledge. For example, if you wanted to give $500,000 and you knew that that's what you could do, but you couldn't do it all at once, and you really wanted to support behavioral health or one of those areas that really need the extra help, we'll do a pledge for you, and you could pay $100,000 a year for the next 5 years. Let's just say your donation even is bigger than that. Depending on the amount, we can stretch it to 6 years, but that's just something we would go through our accounting department with. If it's a smaller gift and you say, I think I can do $100,000 over the next 5 years, then it's broken in to those segments of how you would pay it. Now, I just need to follow up by saying that during COVID, we had several people that I was working with that had really difficult challenges, and they had to rescind their pledge. Now, that doesn't happen very often. It's only happened to me twice. And that is very understandable during certain circumstances. It was just the right thing to do. So there's no legal challenges or anything like that. So I would encourage people to do a pledge. I think that's the easiest. And also they can do a DAV, charitable gift through that area. You will know more about that. But we have a professional here in our offices here in Salt Lake. His name is Colin Ware, and Colin is an expert, and I bring him along with me on several occasions to talk with donors that are wanting to do plan giving. He is our plan giving director. So there are so many ways to give. So don't let the donor be afraid. We just want to talk about it. We're not going to stress them out on it. We just want to hear where they want their money to go.
Yeah. And just as a clarification, a DAF is a donor advised fund. So, if you've set one of those up or looking for instant deductions, but you don't know where you want to give the money to, that's what a donor advised fund is. So you can make the donation, get the charitable deduction, and then decide later where you're actually going to allocate things. So yeah, one really useful tool there. I want to go back to the types of donations. So yes, there's cash. That's the most obvious one. But you can donate things like stock or real estate or other assets that maybe you have. For instance, one of the great ways we can use these charitable donations is if you have land you bought 30 years ago and it's worth a ton more now, you don't want to pay the capital gains tax. You can, through a structure with a trust, donate to the trust sells it and then gives the cash to the charity, or you can even donate the land directly to the charity, they sell it, and then you don't have capital gains tax as well. So a lot of different ways to give. It doesn't necessarily have to be cash if you're strapped for cash right now.
Mm-hmm.
A lot of different things you can do there.
That's exactly right. And I've seen that done. I've seen some particular rural communities that we have a lot of ranchers, and that's exactly what they want to do with their property. And so as they age out and they don't have family to take care of their land, they'll do exactly what you just said and donate it. And we are set up at Intermountain Health to be able to accept all of that, land transfers and stock. We don't take cars, though. I have to say that.
And different charities that do. There's ones that are specifically to take cars and help with that. And that's the beauty of it, is you can find an organization that matches the asset you have and also what your intent is, what is important to you. And I think that's the message I just want to convey through this is there's opportunities. Whatever your circumstances are, you can give. And so it's really cool to see that.
One of the fun things that we do at Primary Children's Hospital is pennies by the inch. It's still alive and going well. It's 100 years old. And when I was a little girl, we did this in California, and it's just a way to give small amounts, and it teaches young people and the younger generations that charitable giving is still very, very important. And so we just wanted to clarify, we have our Festival of Trees that's coming up. Our opening night is December 3rd, and we raise millions of dollars there that goes all to primary children's hospitals. So look around, see what other things are going on, and then we want you to feel good about what your donation is going to. That's the most important thing. I also want to say how important it is to thank the donors often and make sure that the donors know how much they're appreciated, because we can't do this work without you.
Yeah, it's awesome. There's lots of stuff to do, lots of opportunities. Yeah. I've studied this, and there's actually a lot of studies behind those who are more charitably inclined are actually more successful. So once again, even if you're not charitably inclined, there's lots of motivations by it, whether it's the tax strategies or you want to be more successful. There is science to back it up that when you give, you are essentially blessed for it. You will have more success there.
That's good.
But I think it really comes down to how you feel, and seeing the difference you can make is very worth every penny that you can donate, and it doesn't have to be much. So I always like to close out with two questions. Best advice you've ever been given, and then the best advice you could give to anyone else.
Well, I watched Cinderella with my grandkids, the most recent one, and honestly, her words of wisdom were something I'll never forget. Have courage and be kind. The particular work that I'm in is not easy, and oftentimes in one day we'll have a donor say, no, thank you, but we'll have another donor say, I'd love to. So it's a very interesting opportunity. So also is to be still and not to worry. It's all going to work out. And for people that are worried about their finances and all that, that can come with age. And so we need to just trust somebody like you to give us that right advice that we're going to need at the right time in our lives. And we'll know that the timing is right to be able to make that gift. And yes, I do agree I have met some of the finest people in this whole world through this job, and they're very giving, and their lives are prosperous, and they want to give back to the community, and it's so rewarding. So what can I say except that I probably have the best job in the world.
Awesome. Well, thank you, Cindy. Thank you for coming on and sharing your wisdom there. To our listeners, thank you for listening in. Hopefully you can find a cause that's important to you. And yeah, we'll catch you next time on the Trusted Podcast.
Thank you so much, Blake. Have a great day.
Thank you.
You've been listening in to the Trusted Podcast with your host, Blake Johnson. You can find this show on all the major platforms, including YouTube, LinkedIn, Facebook, Apple Podcast, Spotify, and on our website, trustedepa.com. Thank you for your positive reviews, comments, questions, and for sharing this show with others. Please subscribe to make sure you are notified each time a new episode is released each week.